Good evening. My name is Cassina Stevenson, a third professional year PharmD candidate, and this evening I will be doing a journal club. My article is about a 52-week placebo-controlled trial of evolocumab in hyperlipidemia. The authors of this article are Dirk Blom, Thomas Halle, and Michael Bolingase. Background information on evolocumab is that it is a human-derived monoclonal antibody that inhibits PCKS9, which is a protein that reduces the liver's ability to remove LDL-C from circulating blood. Evolocumab significantly reduced LDL cholesterol levels in multiple phase 2 studies. This trial was implemented to evaluate the safety and efficacy of 52 weeks or 1 year of treatment with evolocumab. PCSK9 regulates the expression of LDL receptors in the liver. If inhibited, there is less LDL expression, leading to an increased ability of hepatocytes to remove circulating LDL. The objective of this trial was to evaluate the efficacy, safety, and tolerability of 52 weeks of evolocumab. The trial was designed at 88 centers in 9 countries, including the USA. It was double-blinded, randomized, placebo-controlled, phase 3 trial, and it was sponsored and designed by Amgen. Included in this study were 18 to 75-year-olds with an LDL of 75 or higher and a fasting triglyceride of 400 or lower. Excluded from this trial were patients with heart failure, a recent MI, uncontrolled hypertension, hyper or hypothyroidism, moderate to severe renal dysfunction, active liver disease or hepatic dysfunction, and a recent or planned revascularization procedure, which is the restoration of perfusion to a body part or organ that has suffered ischemia. These subjects included 2,120 patients that were screened. 905 of those underwent randomization. 901 received at least 1 dose of evolocumab. Out of the 901, 111 only dieted. 383 dieted and had atorvastatin 10 mg. 218 dieted and had atorvastatin 80 mg. 189 dieted and had atorvastatin 80 mg plus Zetia. And 800 or 88% completed 52 weeks of treatment. The primary endpoint was the percent change from baseline in the LDL cholesterol level at week 52 in patients receiving evolocumab as compared with the change in those receiving placebo. The endpoint was also assessed separately for each of the background therapy groups. There was no secondary endpoint or a follow-up. The analysis included data from patients who received at least 1 dose of study drug. Repeated measures linear effects model to assess the primary endpoint. This model included the study group, the background therapy group, scheduled visit, and the interaction between the treatment and the scheduled visit. ANCOVA is the analysis of covariance, and this models the effect of more than one independent variable on the outcome. Also, in the analysis was a descriptive statistics for safety endpoints. The primary endpoint is the percent change from baseline in LDL levels at week 52. The 111 that dieted alone had a 57% change. The 383 that dieted and had atorvastatin 10 mg had a 62% change. The 218 that dieted and had 80 mg atorvastatin had a 57% change, and the 189 that dieted had atorvastatin 80 mg and Zetia had a 49% change. The adverse events that were experienced from this study are nasopharyngitis, upper respiratory tract infection, influenza, and back pain. 74.8% of the evolocumab group experienced these, and 74.2% of the placebo group experienced this. The adverse events that led to discontinuation of the study drug occurred in 2% of the evolocumab group and 1% in the placebo group. 5.7% had injection site reactions in the evolocumab group and 5% in the placebo. Evolocumab had no effect on glycemic measures. Myalgia and elevated CK levels were also reported. 2 patients died from the treatment group. .8% of the evolocumab group experienced these, and 74.2% of the placebo group experienced this. The adverse events that led to discontinuation of the study drug occurred in 2% of the evolocumab group and 1% in the placebo group. 5.7% had injection site reactions in the evolocumab group and 5% in the placebo. Evolocumab had no effect on glycemic measures. Myalgia and elevated CK levels were also reported. 2 patients died from the treatment group. The author's conclusion was more than 80% reached LDL level of less than 70. Evolocumab decreased LDL by 57% in patients with a wide range of cardiovascular risk. The strengths of this study are the internal validity, which was randomized, double-blinded, similar variables, appropriate prognostic indicators, and sufficient power. External validity. Results were statistically significant, however, all analysis included data from all patients who received at least 1 dose of a study drug. Weaknesses from this study were that the study did not have participants that had renal hepatic dysfunction, hypertension, diabetes mellitus, no lipid stabilization phase, and the involvement from Amgen may have made the study biased. As of August 27, 2015, the FDA approved evolocumab injection for patients who are unable to get their LDL cholesterol under control with current treatment options. Thank you for your time, and again, my name is Cassina Stevenson.